Hello viewer, this is Animal Doctor YouTube channel and I, Dr. Anil Kumar Saini BVSc&AH is going to share information about the lumpy skin disease in cattle spreading epizootically in northwestern states of my India. First of all, we talk about etiology. The causative agent of lumpy skin disease or novel sitte is Capripox virus. This virus is enveloped double-stranded DNA virus. The infection is more common in exotic breeds and less in swamp buffalo. Okay. When we talk about epidemiology of lumpy skin disease, this disease used to confined in Africa, but after Egypt, Israel, and Kenya, it is now epizootic in Gujarat, Rajasthan, and Punjab states of India. In generalized infection, the LST morbidity is about 80% and mortality or case fatality rate is rising up to 10%. That's very serious. The transmission of LST is from arthropod vector or insect like stable fly, CC fly, housefly, culicoids, mosquitoes, mites, and ticks. This vector transmit the LST virus mechanically from infected cattle to uninfected cattle through biting, piercing, abrasion wounds. The mechanical transmission could be supposed through the insect grasshopper attack in last monsoon from a nearby country, and the resurgence of lumpy skin disease is probably due to heavy rainfall. Transmission through ingestion and direct contact are not common routes, even though the virus is present in nasal lacrimal secretion, semen, and milk of infected animal. The LST virus are generally resistant to drying, survive freezing and thawing, but most are inactivated at a temperature above 60 degrees centigrade. Yes, milk is safe after boiling, and this disease is not reported zoonotic yet. Clear? If we talk about economic importance of lumpy skin disease, the higher case fatality rates and loss of milk production, occurrence of secondary mastitis, damage to skin, loss of fertility, and abortion in cattle are great economic loss measures to farmer. Man, it's really frightening to purchase milk on high rates further. Okay. When we discuss the clinical finding, the LSD, the virus exhibits incubation period 2 to 4 weeks. In serious case, there is initial rise of body temperature, which lasts for over a week. This febrile condition may accompanied by lacrimation, nasal discharge, salivation, and lameness. Multiple nodules, yes, characteristic flattened around intradermal. Multiple nodules of 1 to 4 centimeter diameters appear suddenly about a week later. The numbers of these nodules on body vary from some to hundreds. In generalized infection, these nodules persist as a hard lump or become moist, necrotic, and slough off from a yellow center. The sloughing of nodules exposes the underlying tissue and provide a point entry to squamous flies. Pneumonia is common occurrence sequel in case where lesions appear in respiratory tract. Differential diagnosis of lumpy skin disease is very essential to treat the animal in ethical sense and also to diminish the fear in farmers related to viral disease of cattle. And the differential diagnosis with the skin infection disease should be countered. The viral skin disease, bovine herpes, ulcerative mammalitis, or pseudo lumpy skin disease exhibits nodular lesions up to 2 cm of superficial layer of skin. The nodular scab falls off, leaving discrete, hairless, depigmented lesions. Whereas in LSD, the nodules are larger, flattened, and distended to deep skin layers, and on sloughing, they predispose the underlying tissue for fly strike. And next disease is pseudocowpox or milker nodules disease caused by parapox virus. The nodule lesions are confined to just udder. In bovine papillary stomatitis or parapox virus, the lesions are limited to mouth. And if we talk about differential diagnosis from bacterial disease, in dermatophilus infection, the nodules are smaller, scaled or wart-like, scattered, and are not in a round dimension. Next, bacterial disease, cutaneous tuberculosis, 1 to 2 centimeter diameter lumps appear under the skin of limb, thigh, and shoulder. If lesions are multiple, they are connected in chain by cords of tissue. Rupture of cutaneous tuberculosis nodules discharges green to yellow pus. Necrotic ulcers are absent in cutaneous tuberculosis. And then next differential diagnosis from nematode onchocerca. The lesions are freely, the nodules of onchocerca nematodes are freely movable, fibrous, calcified nodules of 2 to 3 centimeter diameters and canalized by a long body of worm. Lesions are commonly seen on ligamentum nuchae, brisket, and limbs. And next differential diagnosis disease is protozoan basnostosis or elephant skin disease. The skin is edematous and nodules are not visible clearly. In photosensitization caused by Lantera camera poisoning, the lesions are skin abrasion, no nodules formation is there. And other differential diagnosis are with a warble or buzzing fly, demotactic mange, and tick infestation cause hypersensitive dermatitis and urticaria. No nodules like LST are there. And diagnosis in clinical pathology of LST virus is based on electron microscopic demonstration, intracellular eosinophilic inclusion bodies in dermis and hypodermis, PCR, ELISA, FATE, AZID test of formalin fixed lesions from skin, alimentary tract, respiratory tissue, and lymph node samples could be done. If we discuss about treatment, there is no specific cure, but prevention of secondary infection is essential. The use of sulfonamides, long-acting oxytetracycline, and extended aminoglycosides with non-steroid anti-inflammatory drugs, antihistamines, multivitamins, ivermectin, and immunity booster is recommended. Then control of lumpy skin disease is strictly required on farmer level. Control of cattle movement from uninfected to infected territory is an important measure to check wind-borne transmission. The most important factor to check LST virus transmission is to stop the insect vector feeding on healthy cattle. Using the ectoparasite liquid or formalin or sodium hypochlorite spray would help to get rid of arthropod vectors. Then we talk about vaccination of LST virus to uninfected cattle. An effective LST vaccine is not in general use, so the goat pox vaccine or sheep pox vaccine is being used commonly for prevention of virus. And another way to get LST free country is slaughter of affected cattle and destruction of contaminated hide coupled with vaccination of risk animals could be used. In last, we go for postmortem of a deceased cattle, then necropsy findings should be talked on. In general condition of body, the cutaneous lesions after sloughing of multiple nodules on hide and similar lesions would present in mouth, upper respiratory tract, superficial lymph nodes could be enlarged. The cause of death is asphyxia due to respiratory obstruction by necrotic ulcer and inflammation of upper respiratory tract and or concurrent aspiration pneumonia. Thank you.